Okay, good afternoon. Welcome everyone to our Board of Health meeting for July 2024. We'll go around the table and introduce everybody. Myself is Bobby Locke, the Director of Montezuma County Public Health.
Laurel Schaefer, Assistant Director for the Public Health.
Brenda, Prevention Specialist at Montezuma County Public Health.
Ian McLaren, County Attorney.
Kent Lindsay, Montezuma County Commissioner.
Jim Candelaria, County Commissioner.
Gerald Copenhaver, County Commissioner.
All right, did everybody have a chance to look at the April minutes? And any changes? Everybody in agreement? Okay. All right, April minutes are approved. The next thing, I was going to do a short communicable disease update for everyone from the Public Health Department. As far as our flu vaccine for 2024-25, believe it or not, we already have had to order it, and we should expect it sometime in mid-September, our stock for vaccine. So that will be arriving in September. We have to plan way in advance for that. Our Narcan and fentanyl programs, I wanted to give you some numbers, what we've done in the second quarter. So the second quarter goes up through July 2nd. The first quarter, so when we did our Board of Health meeting in January, we had given 75 fentanyl test strip kits out to the public. This quarter, we've given 90 fentanyl test strips. So need is growing, requests are growing for it. Narcan, our Narcan kits, the first quarter we had given out 32 Narcans. And we have given out 133 kits the second quarter. Now, we also did provide Narcan in all the AEDs in county buildings for all departments that wanted it. And then we also have given Narcan out to, we're partnering with the Food Not Bombs group that serves free vegan meals on Sunday in the park. And that apparently, I was not familiar with it. I had to educate myself on that group. But it is throughout the nation. And we gave them, I can't remember how many boxes, of that 133. So they received Narcan as well for their population that they serve. So let's see. And they do that every Sunday from 12 to 1 in Veterans Park in Cortez. So, any questions about the Narcan fentanyl? Clearly the numbers and desires are increasing and needs.
When you hand that out, you don't ask any questions, right?
No, we don't. But the fentanyl test strips, we do educate. We don't just hand it out. The Narcan, it's very self-explanatory. We ask them if they have any questions, but it's for anybody can administer the Narcan. So the test strips, we do provide the education along with it. So then, as far as communicables and infectious diseases, we have already had one confirmed case of hantavirus in Montezuma County this year. We have had 42 COVID-19 cases that we know of. Animal bites, we've had 15 this quarter. We had 20 in the previous quarter. And then as far as STIs go, still a problem. But the numbers of syphilis in particular have dropped in the second quarter, but we still have quite a bit of a problem. West Nile, they've had their first case of West Nile in the state of Colorado in a human. So the message now is, take all the prevention measures to protect yourself against mosquitoes, long sleeves, don't be out at dusk or dawn. You can use mosquito repellent. And basically, we need to be aware of that from now until the first hard freeze, whenever that will be, because it's out there, and in order to keep yourself from getting exposed, that's the way to protect yourself. Any questions about any of that? No? Okay. As far as the measles cases go in general, there's been a total of 151 measles cases throughout the country. Closest states to us that have had measles cases, Arizona and New Mexico. But it seems to have, I don't even want to say it, but it definitely has decreased in numbers recently. So that was as of June 13th, 2024, 151 cases in 22 jurisdictions reported. So that's what I have on communicable disease. Anybody have any questions? No? Okay. One thing I did not put on this agenda, but I just want to mention because it is something that we are doing in public health, I know we've talked about it before, is our community health assessment, our public health community health assessment. And we are in the process, we have developed a draft. We have dispersed it amongst some testers to give us feedback on the format, how readable is it, you know, those types of things. So we're compiling that feedback right now, and then our plan is to launch it August 1st. What I'd like to do is get a time on probably a work session on one of the Mondays coming up, and once we have the draft a final, and bring it to you all before we actually launch it. And so you can see it, and Katie will come with me, and we'll present that to you so you can see it before we launch it to the community. So, and with that, that is something that we are required to do. In statute, every 5 years, we do this assessment and then work on whatever the issues come to light from that. So this is going to drive some of our work moving forward, which will kind of lead into potentially overlap with some of the stuff we're going to talk about. So any questions about the survey that we're going to be?
Yeah, so on the survey, if it's every 5 years that we're mandated to do it,
Mm-hmm.
we need a data too that shows what we worked on and how we accomplished it, or didn't accomplish it, or how do
Yeah.
you make decisions moving forward if you don't have the data
Right.
behind it? Will that be part of that presentation also?
It would be lovely if that was going to be, let's just say we have COVID in there. So COVID was after we did the survey, and when we started to do our work, COVID hit. COVID changed everything. COVID put a stop to a lot of work that had been done, shifted everything. Now we're, out of the COVID, coming back into normal life. Part of what we're interested in from this survey is where are people, because behavioral health was what our focus was based on the last survey results. And so is it the same this time? My guess is it will be, and my guess is it'll probably be more significant post-COVID. But we can absolutely provide, the statistical data from our survey last time and show you how we came up with behavioral health as being, and we don't just we use our local data, but we also use everything that's on the CDPHE website too. We actually put kind of more weight into what the people say in the community, but it oftentimes coincides with what the state is showing too. So we use those things together in unison to move it forward. And so that's what we did historically. That's how we ended up with our CNC program, our suicide prevention model. That was post-survey while we were working on the work, and we did have one of the highest suicide rates in the state at that time. So that's how we got that program going. Like I said, then 2020 changed all of our lives, and a couple years we weren't necessarily working specifically on those things. It was all about COVID. So, but now we are shifting back into more things that we need to address.
So how's this financed?
Through the state.
Through the state?
Mm-hmm.
Okay.
Yes. It's part of our contract. We're not necessarily required to do a survey every 5 years, but every 5 years you have to start the process over of what you're going to do. You can continue to use the survey results from your first assessment and just continue that work. We opted to resurvey because of how things are because of the change that everybody went through with the pandemic, where are people at this point in life? So that's why we wanted to survey again.
Okay.
And that's going to just kind of help drive. It may end up all looking very similar to what it was before. I don't know.
Are we getting a good cross-section of people? I mean,
That is our hope.
Okay.
Last time we did this, I think we got a little over 800 surveys back, which honestly doesn't sound like a lot, but it is a lot. And we got it from multiple sectors throughout the county.
Okay.
And we really want to survey county residents, people who are from, we don't want to survey all the tourists, right? I mean, because they don't live here in our county. But we're not going to say they can't fill it out, but we have a way of kind of weeding that through so that we will be using the data from our people that live in Montezuma County to drive this. So we're going to be doing, I was just talking to Vicki a minute ago, we want to put it out digitally so people can see it online, that this exists. We'll have paper copies. We'll try to deliver it in multiple different avenues. We would love it if you all would hand some out when you go to different events. We're hoping to get into a third Thursday and set up a booth there. They're pretty booked, apparently, but we're going to see what we can do about getting in there. So in a lot of different avenues, we want to get as many voices as we can. I'd love it if we could double that 800. But, when in the grand scheme of things, when we talk to the state about that, every health department is in the same boat as we are. We have to do this every 5 years. And they were actually impressed that we had gotten 800 surveys, actually, last time. So, yeah. So we are definitely seeking out multiple avenues to get the feedback. Any other questions about that? So next on our agenda, we've got transition of CTC. That's the Communities That Care program that we've had at our health department for many years. And we have transitioned out of that, and we are now calling it Healthy Montezuma. Brenda Knapp has been working with CTC for a couple years now, and Brenda Knapp will be our lead on Healthy Montezuma. How we came up with that name, I think Brenda can kind of explain how we came up with that name. But we left that contract with the state on very good terms with the state, and we will be on their radar and continue to possibly seek funding out in the future depending on which direction they're taking with their funding. And basically the reason that we opted to go a different direction and not renew our contract with CTC is because of the scope of the lens that we could only serve was 9 to 20. So public health serves everyone, and so it was perfect for when we did it because it helped us develop coalition work in Montezuma County. I think we were one of the first coalitions to get going through CTC. So really helpful, structured, gave us great foundation to move this forward, but we want to make it bigger, not just for a certain age bracket. So that's my intro to Brenda. And Brenda, why don't you take it away?
I'm here to just give you guys a little bit of insight on what CTC was and where we're going as far as the transition. I know that you guys are all familiar with our prevention programs that we have at the health department, along with our suicide prevention program, which is CNC, or the Colorado National Collaborative. We have our CTC program, which is Communities That Care. It's a program and coalition, and it began in, the grant cycle was 2016-17. And CT's focus at that point had been on promoting healthy youth development and increasing positive behaviors to prevent substance abuse and to promote positive mental health among youth within our community. And CTC considered youth, as Bobby said, to be 9 to 23 years old. When we began, Melanie Begay was our then lead. CTC calls them mobilizers. Melanie got it off to a great start. In 2022, Melanie left, And then again in '23, we had another mobilizer, which was Tricia Hellencack, and she stayed until October of '23. Until that point to now, we really haven't had a Communities That Care mobilizer, but we have continued our monthly meetings. I've been leading those monthly meetings, and with a strong group, we have ended our grant cycle. June 30th was the end, but we continue to stay strong. As of June 30th, so we are no longer under the umbrella of CTC. So we changed our name it is now Healthy Montezuma. Let me back up. CTC built a really strong foundation. CTC was one of the first coalitions, like Bobby said. If not, it was one of the first coalition, if not the first, actually in Montezuma County, and has definitely built the foundation necessary, and has probably done the hardest part of this work, and set the stage for Healthy Montezuma. So we're very thankful and appreciative for CTC. We did, as Bobby said, also we ended on a really good note with the state, leaving our doors open and opportunities open for the future. However, with lots of conversation and several meetings later, this group has decided that the age restriction was too restrictive. So with the grant cycle coming to an end, we've decided to go off on our own, a little different direction, and broaden the age bracket so that it is going to serve all in Montezuma County, not just ages 9 to 23. So our hope is to continue prevention efforts and to reduce substance misuse for all people in Montezuma County, but with a little different approach. And I'm going to share some examples with you that we came up with, and we've talked to our group of members, our last meeting. So the different approach would be, for instance, promoting outdoor activities by utilizing the hiking and walking trails we have here in our area to encourage healthy lifestyle and promote a natural high as opposed to a high that might be substance induced. Another example that we might be doing would be connecting children and youth within our senior population to participate in activities to connect our senior population with our youth, maybe at the senior center. These are some ideas at the senior center, getting our young kids and our youth to go play cards with them, or perhaps learning how to crochet, some of the things that our seniors are doing. And they need connection as well as our younger population. They need to learn some of the old school ways. Connecting our veteran population with young people in recovery group that we have here in Montezuma County, perhaps to our veterans to teach them how to fly fish or tie flies. Another basic concept would be have healthy cooking classes and nutrition classes for families to recognize healthy ingredients and not so healthy ingredients such as hot Cheetos. We know that we see kids eating hot Cheetos and our younger population drinking lots of energy drinks. And so some of these things that are to teach our children and our youth what is good and what is not good for their bodies, so that perhaps when they're older and they're confronted with some of these decisions of substances that are not good, how to deal with that later in life and to have a conscious and more mindful awareness to things that are not good for our body. So we hope to create more opportunities for connection with people in our community who can offer positive role models while presenting our community with healthier options and to promote healthier well-being. So we are currently planning a community event, maybe an ice cream social. We're thinking something down the line. That's going to be planned at our next meeting now in July, mid-July. And we will get a date, an event planned that we can introduce our community to Healthy Montezuma, as well as recruit. So we're hoping to recruit other members into this group of people that are on the same page and of the same mind to try to promote healthier behavior in Montezuma County. So we'll be putting that out. We'll be advertising somehow shortly. And we want to invite everybody in Montezuma County as welcome, as well as hopefully we'll see some of you guys at our upcoming meeting.
I wouldn't
Perfect.
eat ice cream because it's unhealthy.
In moderation.
We can make smoothies.
Oh, Ian, well, now if you're Smoothies are coming out. See, there's a difference, a healthy lifestyle, ice cream lifestyle. But if Ian's with me, I'll give him mine.
There you go. There you go. Then you're connecting.
Yeah, yeah, right,
You're connecting.
exactly. I'm giving what's bad for me and giving it to Ian.
I think the connectedness is really important, and I think, again, post-COVID, you know, everybody was remote, everybody was staying home, everybody is, you know, and people are still comfortable in that zone of working remotely and staying home, and it's like, you lose connectedness when that happens. And so that's kind of one of the things that we really feel that is an important piece of what we would like to have happen in our community. And connecting people who may not normally connect would be awesome, you know, because it opens your eyes to different things in life and different ways of looking at things and being understanding and compassionate for where each other's coming from. So those are important things in life. So any questions about Healthy Montezuma?
I think I'm going to sign up for learning how to play cards with the seniors.
Okay. Good.
Sharpen my card.
With the
playing
seniors? I thought maybe you
skill. The seniors is
would
what
be
she
helping
said. Okay. Yeah, no, I don't think so.
But there's really so many opportunities if we broaden this, and that's why we wanted to do it, to take it more than, because, I mean, just to give you an example, we had an instance where we were asked to do something in a school, and we couldn't do it within the guidelines of CTC. And that did not feel okay for us at that time. So we had multiple kind of things like that were just barriers for us to be able to provide it to the full extent of what we thought we could do. So anyway, that's kind of why we opted out, and not to say we won't join forces again with CTC in the future, because we may. So, were you going to say something? No. You look like you were going to. Okay, well, thank you, Brenda, for kind of giving the update on where we are with Healthy Montezuma. Let's see. Okay, so moving on to the Celtic Fair. I put that down here because we are going to be receiving a donation from the Celtic Fair again this year. We had several of our staff volunteer to help out at the Celtic Fair. They've been very generous with our food pantry, and I don't know exactly the amount yet, but it'll be close. I think it'll be close to $3,000 for our food pantry.
It's quite a growing event.
Yeah. Yes.
I don't think I've ever been to the Celtic Fair either. No. Might just have to be there.
You might have to.
I don't know about you and Kill.
Well. Trying new things, right?
That's
Reaching
right.
out,
Broaden your
expanding my-
horizons.
Yes.
And I mean, our food pantry is, I don't even know how many bags of food we give out every day. We go shopping and we have to replace it the next week. There's a lot of people in need, so, anyway.
So how many, I mean, because there
We
are
do
other-
know how many bags, I just don't know off the
There
top
are
of my
other
head.
food pantries around. I wasn't going to ask you that question.
No.
But, I mean, combined, how many food pantries are in Montezuma County? I don't know if you can answer that or not. But what do you think what's handed out? I mean, we can speak to our food pantry and what we actually give to people. We ask a couple questions on the phone when they call, or if they walk in. We ask them if they have, electricity, if they have the ability to cook, or if it's a microwave, what is it that they have? Do they have ability to keep food cold? Because oftentimes we have, frozen meats and stuff. So depending on what their situation is, that's what dictates what we've put in the food bag. Oftentimes, we try to we have some recipes, and we try to incorporate all the ingredients for the healthy recipe, if they have a full kitchen that they can cook with. And everyone in the department helps gather, because people will walk in without calling, and so sometimes they have to wait a few minutes till we get a chance to go pull the food together and put it in a bag. But we don't ask questions. We just take their name. We write down those specific things about what they have capacity to do. And then they can come every other week, right? It's every 2 weeks for a bag of food from us. Now, you know, there's the 2 soup kitchens that feed people. They don't hand out food necessarily, like bags of food. What I know, Good Samaritans.
And then there's another big Spanish-related one
In Mancus,
and then
yeah.
there's one in Dolores, the Dolores Food Project.
So.
The Baptist Church, I think.
I'm not sure about that.
Is the
Okay.
one up on North Beach, is that kind of a combination of groups?
Yeah, yes. And that, I can't, Delilah's a better spokesperson on what, because remember they had like a food pantry, but I think there's been some change there. And I don't want to speak to exactly what's actually going on right there right now. Because there's been a few things. They used to have a market, you know, where you could order online and pick up your groceries. You know, they had several things, so I'm not sure. We were like doing our diaper, our monthly diaper giveaway. We were doing it there, but we've since moved it back to the health department. So we do our diaper giveaway out of our department now. So I can't really explain what's happening there. Yes, yes, monthly. Yeah. Yeah. So I do think, I mean, we literally could give folks weekly food bags, I think. We can't, but that's why we do it every 2 weeks. And we just track it that way, so. But there's a huge need. And I don't know if any of you do any grocery shopping, but it's terrible what groceries are nowadays, so. And if the healthier you try to eat, the more expensive it gets, so. Okay, so we are getting that donation. Should be coming sometime this week, I think Linda had said. So next on our agenda, we have the OPHP, which I should have written what that stands for. Office of Planning and Public Health Partnerships. They've changed their name 3 times in 3 years. So, anyway, so where the L went in there, I don't know. But so they are our primary source of funding through CDPG, basically. And they have partnered with us and asked us to do a mini conference. I'm going to let Laurel take this away and tell us about it.
So OPHP is, like Bobby said, the basic overarching of public health in general. They take care of a lot of things from consumer protection to maternal child and health, child fatality. They do a lot of broad stuff. They reached out to us. They're trying to connect local health departments together. And I agreed to spearhead this for our area. So we are doing a Four Corners Public Health mini conference. We will be holding it in Dolores at the community center. We've invited the Southern Ute Indian Tribe, Ute Mountain Ute, Dolores County, Archuleta County, La Plata, and San Juan County, and of course Montezuma County. So we're expecting somewhere around 50 to 60 people to come, and it's just basically going to be a day. They're paying for everything. They're hosting it. They are doing the trainings. So it's Tuesday, July 30th at 8:30. And our agenda is we're going to start by talking about core public health services. There's a big turnaround in the health departments in all of these areas. And so I think you guys probably took the Board of Health training. They're the ones who create that. This is going to just give everybody kind of an overview of what public health really is about. And then we are doing leadership skills for a couple of hours. They're going to do that. Of course, lunch, and then facilitating meetings. So we're going to have a few breakout sessions. But I think for me, the most important things were that they recognized us and asked us. So I felt a responsibility to host. And the other best thing is that we get to connect with people from different health departments. Archuleta and La Plata have gone through a lot, lost a lot of employees. There's a lot of new employees. But we do a lot of the similar things. And so it'd be nice just to have somebody to meet, like Linda, for example, to be able to have somebody she can bounce something off of if something comes up. So, yeah, it's pretty exciting.
So I want to thank Laurel for spearheading getting this off the ground, because I do think we've had a pretty good response. I don't know the exact numbers, but most of the counties have responded, and they are planning on attending, at least 2 or 3 people, maybe more.
And they are doing this across the state in different regions.
Mhm.
So, yeah, we'll see. And we're using a local caterer, local building. So.
Do we ever have any contact with Utah, New Mexico, or Arizona? No?
No, we do have a tribal liaison who helps us with Ute Mountain Health.
Right.
But really, we don't, other than occasionally through communicable diseases or those kind of things. Yes.
Anything from the Navajo Nation?
Not along this line,
Okay.
Yeah, not
but
all.
other avenues.
Okay.
This is all just within these
Right.
5 counties in the state.
Like the region? Yeah.
The region. Okay.
Yeah. Yeah, we'll just leave it there. So,
We actually do have conversations with commissioners in both of those counties, so we ask them, I mean, how is your public health department? I mean, after the implosion.
yeah,
So we actually talk to them quite a bit.
right. Yeah, I think it's a great opportunity to bring all of the kind of, as many as folks can spare at their departments, obviously, to come to this event. But I think it's a great opportunity to bring everyone together, because we all have we have similar needs and similar asks, and it's nice to know who your neighbor is, even if you need a hand, with something. So, and we typically do that, so.
And I think, I mean, we have a really good working relationship with all 5 of those counties and their leadership, but sometimes our staff doesn't,
Right.
because they're doing other things, and it'll be really nice for them to be able to connect with each other.
That's very true, because
So-
oftentimes a lot of the opportunities to go to meetings or public health in the Rockies or things like that doesn't always get opened up to every employee, right? And so it's usually people that might be in positions of leadership that get those opportunities, but not everyone else does. And they're at a disadvantage, because they're only going to receive what we bring back to them. It's not the same as having those connections with your peers. So having the opportunity to have something a little more local, and we're having it in Dolores, so it is, convenient. And it's just a really good opportunity, and it was impressive that the state wanted to do that. And I just got an email today, CalFO, there's a couple of folks from CalFO that want to come down to the region. So we're working on early stages of planning that. So, yeah. So it's all good stuff.
All right.
Yeah.
Well, very good.
My last item on the agenda here was for next meeting in October. We tentatively, Dr. Atwell and I had planned on her coming today, but it didn't work out with her schedule, so that's why she's on for the October meeting. And she's the
Dr. Asha Atwell is the Sih Hasin physician with street medicine. And so they come to our county every Tuesday and provide services. And they travel. She's one of our connections throughout the multiple states, all 4 states. But she does a lot with our community members as far as prevention, education, and treatment options. And so I asked her, she had never come to talk to you guys or meet you. So she wants to come, and we're going to have that conversation about what she does for our community and what the gaps may be and how we can work together. So, okay. And Dr. Mullen will be here as well.
Are you sure?
So, yeah. So that's, we'll have that planned for October.
All right.
You have
Very
any
good.
questions about anything else?
I
Okay.
do not, other than, no, I do not.
Okay. All right. Well,
All right,
I think that's it. Thank you.
very good, thank you.